Creative New Jersey usually convenes people in person, right? But now with our shutdown, you know, no one's allowed to gather in person together. So we started these briefings on April 1st as a way to keep our communities connected, to advance a dialogue around critical issues that are affecting everyone, to help continue to build social cohesion and trust, to help foster some cross-sector partnerships, and generally help people feel informed and engaged and connected. So that's why we've been doing these calls. And as Kacy had mentioned earlier, today's briefing is the 6th in the series. We started on Wednesday, April 1st, and we're going through the end of May. We gather from 10 to 11, and we're really grateful to all of the guest speakers that have joined us over the last several weeks to help share some really important information on their specific areas of expertise and to help advance the dialogue around the things that matter most for folks during the pandemic. Today's call has been developed in partnership with our friends and colleagues at Eyes Like Mine and the Center for Nonprofits. We're certainly grateful to our guest speakers today who come from the Office of Emergency Management at the New Jersey Department of Human Services, the Progressive Center for Independent Living, and the Commission for the Blind and Visually Impaired at the New Jersey Department of Human Services. So before we turn over to our first speaker, I just want to invite Crystal Allen from Eyes Like Mine. Crystal, do you want to unmute yourself and do you want to just say a hello and a good morning to everyone? We're grateful that Crystal worked with us in putting together today's briefing. Let's see, I can't find Crystal. Kacy, do you see her? Can we unmute her?
Let me see. I'm not sure. Crystal, if you are on the call. Oh, did I just hear you?
Maybe while we try to find Crystal, I can also ask our other colleague, Debbie Duncan. Debbie, can you unmute yourself and do you want to just say a good morning to everyone? Thanks again for working with us, Debbie, on putting this together.
Sure. No, I'm the Center for Nonprofits and Creative New Jersey have had worked together on a variety of things over the years. There's a sort of a mutual admiration society. We really appreciate the work that Creative New Jersey is doing in our communities. What struck me as the origin of this program was that I have been on these calls, and Crystal Allen, who has been a volunteer for the center, she's volunteered for our conference, and I have consulted with her since then about ways that we can be you know, more accommodating to people with special needs. And then Crystal attended the Creative New Jersey conference through contact with another friend and explained some of the barriers that exist currently that are making it harder to access COVID relief and other services and benefits that are going on right now. So this just, it all came together because of all of these connections. That's what Creative New Jersey is all about, is bringing communities together. Let's talk about what's happening. Let's share what our observations, our resources, the needs that we see. So it's all about people connecting and communicating about our experiences. And I just, I'm delighted to be part of it and love to appreciate these circumstances that pop up like this, but we have to make them happen. And Creative New Jersey is a tremendous force to do that in our community.
Thanks, Debbie. Thanks for all of that. And as you said, it is the mutual admiration society between Creative New Jersey and the Center for Nonprofits. And if we have some friends on the call today who are not familiar with the Center for Nonprofits, please avail yourself of the really important and effective and impactful work that the center does for our entire sector in the state. So please be sure to check out their website and take advantage of the good work that they offer. So I do see Crystal here. Crystal, I'm gonna unmute you. So Crystal, you're unmuted. Do you wanna say hello?
Oh, hello everyone. Thank you for joining the Creative New Jersey Community Call today in collaboration with the Center for Nonprofits and Eyes Like Mine Incorporated. I'm really glad that this is one of the conversations that is taking place in the series of the Creative New Jersey Community Calls, especially because it focuses on what's available and what the issues are as it relates to New Jersey residents with different disabilities. And I'm particularly excited that Dr. Davis is one of the speakers, as well as the other two dynamic speakers. I'm sorry if you hear any of my voiceover, but I'm using my screen reader software. And I just thought that it would be a great opportunity to have people with disabilities issues kind of be a part of the forefront of conversations, because there's a lot of conversations taking place right now as it relates to the pandemic. But a lot of the conversations that are general are not always including people with disabilities. So I was really grateful that Creative New Jersey was receptive to the idea and making sure that all of our voices are being heard. And for those who are working in the field of service and helping and maybe having consumers who have different disabilities or being a professional with a disability, this platform is a platform that is being shared so that we all can share resources to help us navigate through the pandemic.
Thank you, Crystal. Thanks for all of your work with us in making today happen. And we look forward to continuing our work together in the future as well. Crystal was a really important member of our newer call to collaboration that we held back in June. And of course, many of you on the call know we were supposed to hold that second call to collaboration on March 19th and 20th. So we had to hit the pause button there. But we look forward to returning to Newark and then lots of other communities as soon as humans are allowed to be together again. So just before we introduce our first speaker, Kacy, would you like to say something else just before we introduce Joe?
Yes, so thank you. We will now be switching from Audrey as our primary ASL interpreter to Tabitha. So for those of you who are using that, please unpin Audrey's video from your screen by looking for the little unpin tack icon, usually in the upper left-hand side of your screen. And you can find Tabitha's video. For those of you who might need to move back to gallery view, where you see all of the different videos of all of our participants, you can click the upper right-hand corner from speaker view to gallery view. That'll give you all of the videos for all participants. You can find Tabitha's video. She is signing right now. And go ahead, hover your mouse over her video. You'll see the three dots, the blue icon in the upper right-hand corner of her video. Click that, and then pin her video to your screen. It'll get easier as we continue this process and you get familiar with it. But once you've pinned Tabitha's video, we should be good to go. So thank you.
Great, thank you, Kacy. So can I ask everybody to take a deep breath? And we bring our attention into the center of our Zoom room. You know, everybody's dealing with a lot of pressure that's been brought on by the pandemic and the shutdown. Everyone is challenged with figuring out how to do our work, you know, in a new way. And many of us are spending endless hours on Zoom calls, right? So we know that sometimes it's really hard for us to focus. So we're just going to take a moment. We're just going to focus. We're together. We want this to be a conversation. We're grateful to our guest speakers, but we also want to hear from all of you. Thank you to everybody for being with us, for being on video so that we can see each other and keep our sense of community really strong. So now it's really my great pleasure to introduce our first guest speaker, Joseph Geleta. Joe is the Director of the Office of Emergency Management at the New Jersey Department of Human Services. Joe and I first had the great pleasure to meet and work together in the months and then couple of years after Hurricane Sandy. I know that, you know, the work that Joe has done in his career in service to the people of New Jersey is really significant. I'm certainly grateful that my path crossed with Joe, and I'm really grateful to him that he's on the call today. So Joe, I think you're unmuted. Thanks for being with us, and thanks for giving us this big 30,000-foot overview of what you're seeing from your very big platform at the state.
Well, good morning, everyone. I want to thank Elizabeth and Kacy from Creative New Jersey for inviting me to speak to you all this morning, as well as the Center for Nonprofits and Eyes Like Mine. It's very important we continue to engage in these discussions during this pandemic. But a little bit about myself, I'm Joe Geleta. I work for the Department of Human Services, Office of Emergency Management, and we work closely with the state police because, as most of you probably don't know, the state police coordinates emergency management in this state. The only other nation that has the state police coordinate emergency management is Michigan. So we work in coordination with Colonel Pat Callahan of the state police, who serves as the director of emergency management, in putting together the state's emergency operation plan. So the state's emergency operation plan is broken up into 15 distinct units. Our unit, the Department of Human Services, manages number 6, which is mass care and emergency assistance. So generally, we're involved in sheltering, feeding, distribution of emergency supplies, and family reunification in the aftermath of a disaster. That's what we do in support of the state police and all our partners around the state. Right now, we're working in coordination with the state's Emergency Operations Center because it's activated in response to this pandemic. And as you would probably surmise, ESF8 number 8, Emergency Support Function number 8, that's managed by the Department of Health. So clearly they've been very busy, and we've been supporting our Department of Health colleagues at the State Emergency Operations Center. Most of you probably know disasters always start local and end local. We work in coordination with our local offices of emergency management. If the local office of emergency management becomes strained, they ask for support from the county office of emergency management. If the counties become strained, they ask for the state's assistance. So we work in coordination with all our county partners across the state when they ask for specific resources from the state's Emergency Operations Center. When we become strained, the state, we ask our FEMA colleagues to support us as well. Some of you probably know that in response to the coronavirus, we received a presidentially declared disaster back in March. It's DR 4488, and it opened up the state for FEMA assistance. Assistance relative to public assistance, which is for Category B, which is emergency protective measures, and also for individual assistance, which is strictly limited to crisis counseling. But as Elizabeth alluded to, this isn't like the normal disaster that we are responding to. It's not like a flood or a hurricane. It's really a never-ending marathon. And many of us are engaged 24/7 throughout the day in helping those we serve. So I can't tell you how important that crisis counseling piece is, not so much for the people we serve, but for us. Many of us are working long hours, and it's important for us, as Elizabeth said, to take that breather every now and then. There is a crisis counseling helpline that's been set up. I'll say it now and I'll reemphasize it again. It's very easy to remember. It's 866-202-HELP. 866-202-HELP. That's 4357. It's available 7 days a week from 8 a.m. to 8 p.m. And it's always good to take that breather and have someone to speak to when you're in times of crisis. Not so much for the first responders that are doing so much, but also for the people we serve. So we have many partners that help us out in mass care in this state. It's not just the state, county, and local governments, but it's many volunteer organizations, community-based organizations, non-governmental organizations, faith-based organizations, and voluntary organizations active in disasters. We rely on many partners to help us out. It's not just the Department of Human Services, but it's the relationships we foster that make a difference in disaster response, especially for a pandemic response. So Commissioner Carol Johnson is very proactive in making sure our vulnerable and disability and access and functional need populations are served throughout this process. Early on, she sent out emails to our County Office of Emergency Management partners to make sure they're connecting with those vulnerable populations, whether through Register Ready or through our various divisions, our divisions of developmental disabilities, our divisions of disability services, our division of the deaf and hard of hearing, the Commission for the Blind and Visually Impaired, our division of aging services, and of course, our division of mental health and addiction services. All our divisions, thanks to the leadership of Commissioner Johnson, are thoroughly engaged in supporting our most vulnerable populations throughout this crisis. More importantly, the wellness checks are so critical. For those that may be feeling socially isolated, we're trying to conduct wellness checks. So it's that simple phone call that's conducted by our county offices of emergency management or our division of aging services or many volunteers that are helping out to connect to these people that may be socially isolated and ask if they're okay. Ask if there's any resources they may need. I know one of the programs we're working on with our division of aging services in coordination with the county area agencies on aging is making sure that those seniors that may need groceries delivered have volunteers to make those deliveries. So we're working with many volunteer organizations to do that in some counties that want to engage with their seniors and make sure they get food delivery to them as well. A lot of our volunteers are also helping out at food banks to put together emergency food boxes that are going out to those in need. So as I mentioned, Commissioner Johnson is very proactive in this. She recently received much needed funding, $36 million to support New Jersey's Supplemental Nutrition Assistance Program, $24 million to support the disability and access and functional needs, especially those direct service providers that wanted wage increases because they're really going onto the front lines. So she secured $24 million in funding from the Families First Act, $6.3 million to support the feeding of our seniors for those that are socially isolated and need food delivered to them. That's one of the programs we're working on through our Division of Aging Services in coordination with the county area agencies on aging, and $20 million to support emergency childcare. So we're very much engaged with many of our partners. We have weekly calls for our New Jersey Gained group. That's the group for access and integration needs in emergencies and disasters. We have weekly calls with our county access and functional needs coordinators. We have our core advisory groups that are linked in distinctly to the disability and access and functional needs community. In addition to many of our statewide centers for independent living, which you'll hear from in a little bit, we're very much engaged because it's the vulnerable and the disability and access and functional needs population that is so needing of services. So we try to connect with them during this time of crisis, which, as I mentioned, it is a marathon. It's not the flood that ends after a week, the hurricane that ends, it passes, it's done. It's never ending. And we're looking at possible spikes in the fall of more coronavirus. So please take care of yourselves. That crisis counseling line is very important. The 866-202-HELP. Please contact that. We have many resources available on the Department of Human Services website that I encourage you to visit. I know Kacy was going to list those websites on the sidebar. In addition to the State Office of Emergency Management website, the COVID-19 website that's out there from the state of New Jersey. And for general information regarding wellness during a pandemic, visit the cdc.gov website. So I thank you all for this brief time to speak to you. Are there any questions at all from our perspective from the Department of Human Services and the Mass Care team that's working so hard throughout this pandemic?
Thank you, Joe. It was really appreciated all of that great information. And yes, Kacy's been putting links in the chat function. I'm going to turn it over to Kacy to moderate a brief Q&A with Joe. And just so everybody knows, Joe is going to have to leave us in about 5 to 10 minutes. So now is your time to ask Joe some questions. Of course, if you think of things afterwards, you know, we can help get you connected to Joe in the future. But Kacy,
Great. Thanks, Elizabeth. Thanks, Joe. So as a reminder, if you are joining us on video and you have your participants button open, you can hit the blue icon. That's the little raise your hand. You can also *6 to unmute yourself if you're joining us by phone. And you can unmute yourself on your keyboards on PCs by hitting Alt-A and on Macs by hitting Command-Shift and then the letter A. I do see we have a question from Arlene Romoff. So Arlene, I'm going to go ahead and unmute you.
Okay.
Oh, there you go. So go ahead and ask your question.
Okay. Yeah. Thank you so very much for having me. I'm Arlene Romoff. An advocate for people with hearing loss. I am deaf and I have cochlear implants. This forum is exceptional. There's one very specific issue for people with hearing loss right now, and it's critical. It's masks. When people wear masks, you are making virtually everybody with hearing loss deaf. The mask itself reduces the decibel level to the person who is communicating with you, depending on the mask. Also, you're eliminating all lip reading. So even people who are sign language users need facial expressions, but people who are on the 98% of profound to almost normal are rendered deaf when the mask goes on. So it's very important to realize that don't leave it up to the person who's struggling anyway. So be aware of this and come prepared with communication tools, which can be paper and pencil or note writing, iPads, phones. There are apps that actually do automated captioning, Google Transcribe, Google Translate, Ava, Otter. This is all very useful in opening communication. So that's what I wanted to make you all aware of. We just had a very big seminar on Monday about this issue. It attracted 200 people ad hoc. It is impacting everybody with a hearing loss, which is essentially a huge population. Also be aware your seniors, they virtually all have a hearing loss. So be aware of that when you're communicating with people with a mask on. It's going to require more, even for people with normal hearing, with that decibel loss. Okay, that's what I wanted you to be aware of.
Thank you, Arlene. You know, Arlene and I met many years ago, so it's great to see you on the call with us this morning, Arlene. And can you
keep us apart?
I know, it's so good to see you. Can you just send me your, I want to make sure I have your current email address. Can you just chat me privately in the chat function?
Sure.
Because also,
it's the same as the old one.
Okay, great. Then I have it, because I'll follow up with you to make sure that things that you just shared with us on the call, that we have some specific information to fold into our summary report that we send out tomorrow, you know, after this call. So I'll do some follow up with you on that.
Thank you.
Thank you.
Great. Thank you, Arlene. Are there any other questions at present? Let's see, I have, okay, so we've got, just for folks, we've got a link that someone dropped into the chat box, which this is absolutely exactly what it's for. That has a link to some other kinds of masks that potentially might be useful. You know, those are links that you can click through and see. I've seen a couple of masks that people have started making that have clear plastic windows around the mouths, so that lip reading can be seen through some masks, but clearly there's not enough of them out there for sure.
Well, also I would like to add to that, those masks are not appropriate in medical settings. They don't have the protection. So while they are good for social communication, but not in a hospital.
Great. Thank you for that, Arlene. Any other questions or comments for Joe at the moment? We just want to be mindful of the fact that he's going to have to bounce off in a moment. Is there anybody on our phone lines who would like to ask a question or make a comment? *6 to unmute yourself. Okay. So I'm not seeing any other questions coming in at present. I will just share, Joe, that there's a comment from Amy Boroff at the Department of Aging, I believe, and she says that they've coordinated their efforts on the municipal level and with volunteers, and we've coordinated efforts for volunteers to help seniors, and she very much appreciates that. So sharing that out with everybody as well. If there aren't any other questions at present, we can probably move on to our next speaker. So Joe, stay with us for as long as you can. Obviously, whenever you need to jump off, jump off. I just do one other, okay, that's just a thanks to you, Joe. So as we start to head into our next speaker, we will be now again switching our ASL translators so that we can give folks a break as we go through this call. So please unpin Tabitha's video from your screen and find Audrey, and she will be our next ASL speaker. Again, you can do that by hovering over the video, unpinning from the left-hand side of your screen, finding Audrey's video in the gallery view, and then clicking the icon with 3 blue dots to get the drop-down menu that allows you to pin Audrey's video to your screen. And thank you, ladies, for being wonderful and co-signing as we're moving into this transition. That's fabulous. Okay, I think at this point we can go ahead and introduce our second speaker. Elizabeth, off to you.
Great, thanks, Kacy. And Joe, all of us just thank you again, right, for being with us. Really appreciate everything you're doing for the residents of our great state of New Jersey. So now it's my pleasure to introduce Scott Elliott. Scott is the Executive Director at the Progressive Center for Independent Living. We were introduced to Scott from our colleague, Debbie Duncan. And Scott is here with us today. He's going to talk a little bit about his perspective on how people living with disabilities are being affected in independent living centers, you know, amidst the COVID-19 crisis. So Scott, I think you're unmuted. Thank you so much for being with us today. We really appreciate you sharing your time and your expertise with us.
Well, thank you. Absolutely. This is very important. Some brief background. You know, of course, I'm part of Joe's group, the statewide group for covering access and functional needs, which is a very large group that meets typically once a month or thereabouts, but now it's meeting once a week. It used to be called Special Needs Advisory Panel years ago. I'm agent myself, been involved since for about 20 years now. Again, I'm the executive director of the Progressive Center, but I'm also the chair of the New Jersey Association of Centers for Independent Living. And to make something very clear, when you see independent living, we're not housing providers. We will help people. We're one of over 500 centers for independent living across the country, across the nation. And I'll talk to this a little bit relating to our current situation, but we will help people find housing, apartments, and et cetera. So that's always an important clarification to get out there. There's 11 centers for independent living in New Jersey. We're governed by people with disability. Our boards of directors are majority people with disabilities. Our staffs are made up of many people with disabilities. And I've been involved for about 20 years and actually doing emergency preparedness education for about that same length of time all along, to just have people with disabilities, their families, human service providers, and even first responders better prepared for this. And as we're learning, you're never prepared for everything that comes our way. So the centers across the state have actually reached out and made contact with over 15,000 people with disabilities since the middle of March until the end of April. That's ongoing. Wellness checks, as Joe mentioned, are a big part of that because of everybody. There's such an unknown out there with how folks are doing. Centers work with people with any or all disabilities. It does not matter any age There's a huge overlap, as you can imagine, with folks that are aging, our senior population. We work in schools, so we're really quite all over the place. And centers, the mission of the centers is to provide core services and supports, and we're advocacy based and been around since the early 70s in California, where they were started. And that's, we're community based, we're boots on the ground, we're in the communities. And we're actually right across the hall from Debbie and Centers for Nonprofit. We're neighbors as of last summer. We have our center has an office in Huntington and in Lebanon, just north of Flemington. But all of us, we have some satellites. All the centers cover every county. Some centers have 1 county, some centers have up to 3 or 4. And during this, the pandemic, we did training years ago, but it never prepares you for the actual event. And like Joe said, it's really ongoing right now. Wellness checks is a big part of what we've been doing. Food's been a big issue. I got to say, across the state, and as you're all probably aware on this call, if you look at Jersey, Central, North, the numbers are there's a big change between the numbers between Central and North to South Jersey, and I think South Jersey's getting hit a little later in the game here. Personal care assistance, I know, is a big problem across the state. Myself, I've narrowed down my personal care assistants to 4 people. That sounds like a lot. And I've had to interview those individuals to make sure they're keeping safe, not only for themselves, their families, but also since they're interacting with me and my family, you know, so that's just one thing that we've worked with across the state to make sure our families that are at home continue to get good service from their personal care assistants. So everyone really, you know, a lot of people with disabilities and their families are natural planners. You would think it does give us, it does help us in these times. However, the pandemic has really limited, or it's really another way to look at this, has really increased the challenges for many of us. And I happen to be lucky that I have all my equipment at home. I've even got a whole house generator. During Sandy, I was having people come to my house, take showers, charge their cell phones. But certainly, I'm probably at the high end of operating during an emergency. We've got folks, and now we're seeing the social isolation and anxiety kicking in. I know our center has taken on something weekly that's been a huge hit, and that's doing a Zoom positive activity. We've done some art drawing classes. We've done some music situations. We have a caricaturist coming on this coming Friday. So we're starting to look at ways we can help families and individuals in a positive way to keep them busy, because I heard that from someone else today too. Of course, one of the things, and I'm going to speak as I move along here, I'm going to speak to all the centers have the same mission and work similarly. Some of us have taken on many other things moving forward in time, and some of us do some great local advocacy. So we do vary, but our missions are the same. How we're set up are the same. You know, when we do the wellness checks, we find out, and centers are, for instance, are in place to help people and families with darn near anything and everything. Fill out forms. We've even had unemployment, you know, a person that was employed or two in our center that they needed some assistance filling out forms. So the issues that we're experiencing are pretty much, I think, issues across the board with people with disabilities. So we've had people that had to leave a group home. We assisted them in getting renting a hospital bed until they could get the proper bed. So we found assistance and even some financial assistance to help them. I believe Joe may have mentioned, or somebody else, about masks. I know Arlene did, as far as the hearing loss situation. picking up food, drug assistance. There is a slew of things. We could probably spend all day just on all the topics, and then it is enhanced for people with disabilities with the limitations. We know we're constantly communicating with people, and I also am affiliated with Project Freedoms that are growing around the state, and they're campuses for people with disabilities. So we help a lot of those folks at those particular locations. With again, going back to food, I'm looking at my list here. There's so many different things. We had another situation where somebody moved from a group home that needed to move in with their family, but needed a ramp to get in and out of their house during this time. So again, we're just going to keep working that way. The products, hopefully keeping people safe, advising individuals and families on what to do, not to do in the homes. And again, we're going to continue. We'll probably double that over 15,000 number across the state. And I think we've got a good feel. There's many other agencies. I think we're unique in that we work with so many disabilities and ages and so forth. So I don't want to keep rattling on because I like to see if there's some questions related to our disability population, which is very, very broad. Again, moves into the senior. We work closely with the most of us work closely with the aging offices around the state. We've been working with the students in schools, some of the high school students getting very antsy being at home. We're going to help them find jobs and so forth. So, and I know one of my colleagues is on the call too, Don from Atlantic County, a director for Atlantic County. But let me stop there, Elizabeth or
Thanks, Scott.
Kacy.
Yeah, thank you so much for all of that information. Does anyone have a specific question for Scott?
And as a reminder, you can raise your hand by clicking the blue icon in your participants section if you're joining us on video, or star 6 to unmute. I do see a question from Donald Campbell. So Donald, I'm going to unmute you. Go ahead.
Yeah, well, Scott really hit everything. I'm the executive director of the center in Atlantic County. We're the Atlantic Center for Independent Living. I just wanted to introduce myself. I think these calls are great. It's my first call, and I'm already loving it because it's connecting everybody. And sometimes it's hard to figure out what everybody in the disability world is doing. But I just wanted to highlight that really Centers for Independent Living are supports and resource centers for anyone with a disability. We exist in every county, so you can easily find us just by Googling us and connect anyone with a disability to us. We have no age limit. We have no time limit. So that's what makes us unique from a lot of other agencies. We can work with somebody even if they're young, old, anywhere in between, and all they have to do is communicate with us, really. So, they don't have to worry about, us going away in 3 months. So we really function as a support system for a lot of people who don't have it. So I just want to highlight that. Scott did a great job talking about everything. And a lot of our services now are online because a lot of us are all working from home. So really just keep your head out for us, and really don't be afraid to refer people to us, even if you're not exactly sure where they fit, because even if we don't have the ability to help them, another thing we're great at is finding creative ways to connect them to resources and just troubleshoot with them. So we really operate that way. So I just wanted to add that in, and thank you for having these calls.
Thanks, Donald.
Thanks so much, Donald.
Relationship building is what we're all about. Long term, we have a lot of folks that just stay connected with us with questions and assistance they need. You can find all the centers if you go to njsilc.org. Again, njsilc.org. It's New Jersey Statewide Independent Living Council. All the centers are listed. Our association website's under construction, so you can go there. You'll see all the centers listed by county and how to contact those centers. Again, we're gap fillers. We really are. There's so many gaps in services and supports during regular times, let alone now when everything is much more magnified.
Yeah.
We're really we're peers. We do so much in all different areas. But let me stop there and see if there's any more questions.
Thanks, Scott. You know, I think just in the interest of time, I think we're gonna turn to Dr. Davis for an update now. But you know, as lots of folks know, we all stay on the call past 11 o'clock for anybody who can continue to stay on and wants to continue the conversation and ask more questions. So I think, well, if you can stay with us for a little bit afterwards, we might have an opportunity to ask some more questions.
Sure.
And
Great.
if you're watching the ASL signer, you can, Kacy, were you going to do this? Is that what you were just?
Yes. Yeah, that's all good. Yeah. So we're going to now, again, switch our video feeds for ASL interpretation from Audrey to Tabitha. So remember, unpin Audrey's video and then pin Tabitha's video, and Tabitha will now continue signing for our next speaker, who is Dr. Davis. So Tabitha, you can take it away there.
Great.
And Dr. Davis, if you want to, let's see, you're unmuted already. So Elizabeth, go ahead.
Yeah, thanks, Kacy. So we first met Dr. Davis because of our friend and colleague, Crystal Allen at Eyes Like Mine. And we're really so pleased to welcome you today to the call. Dr. Davis is the executive director for the Commission for the Blind and Visually Impaired at the New Jersey Department of Human Services. So we're so grateful that you've carved out time to be with us. The work of the commission is really important and impactful, and thanks for sharing your expertise with us today.
Good morning, Elizabeth. Thank you so much for having me. Thank you to all of Creative New Jersey, the Center for Nonprofits, and also to Eyes Like Mine. Thank you very much. It's a pleasure to be here today, to have this platform just to share information with people if they're having any kind of challenges with being blind, being deafblind, or visual impairment. And I'll just say a little bit about myself. I have been working for the Department of Human Services for 26 years now, and I've been with the Commission for the Blind and Visually Impaired for 16 of those. And it has been a privilege. Our mission at the Commission for the Blind and Visually Impaired is to promote and to provide services to persons who are blind, deafblind, visually impaired, just to help with whether it's eye health, being independent in someone's home, with work. Employment is a huge service that we provide. And, you know, I would also like to say that New Jersey, the Commission for the Blind and Visually Impaired, we have regional offices statewide. So our administrative offices are located in Newark, but we have a training center for people who are blind, deafblind, and visually impaired in New Brunswick. We also have a regional office in Newark, New Jersey, separate from our administrative offices. We also have an office in Freehold, Cherry Hill, and also Atlantic City. So, and in all of those offices, we offer services, several programs within 5 areas, and those areas being, as I mentioned before, vocational rehabilitation, where we are focused on people either maintaining their employment, training for employment, if that is the track that they would like to go. We have people who may not be interested in employment, and that's fine. We have independent living services. So those services are for all ages. All of the Commission for the Blind services are from infancy all the way until senior citizenship. So our independent living services, we offer eye health to people who want to know more about their eye health conditions, particularly diabetic education training. We offer orientation and mobility. So if somebody is needing to learn how to travel, whether it be to work in their neighborhood, that is also a service that we offer. Under our independent living program, we also have a program called Project Best. That is a community service where we offer eye screenings throughout the state of New Jersey. Also, if there are emergencies that somebody is experiencing, they may not know what to do in terms of their eye health condition. We would definitely hook them up with emergent resources, but also if it's not an emergency, we have resources with doctors who specialize in vision. So we're absolutely able to refer persons. Also, I would like to say in terms of the services that we provide, we have a program under independent living as well. It's called Aspire, and that is a peer-to-peer support program in the community. We started it in 2015, and now 5 years later, we actually we started 2015. We had 23 peer supports groups, and now we have over 59. And I want to highlight the Aspire program because it is a peer-to-peer support group, and there are meetings that occur throughout the state. And when we spoke before about social isolation, it's huge. So the Aspire groups, they are there in the community. If people are dealing with visual adjustments or people just need a platform to connect, our Aspire programs, they are key. Also, if somebody is interested in getting more information about our Aspire program or any of our services, you can find them all at www.cbvi.nj.gov. And as I said before, the Commission for the Blind and Visually Impaired, we're under the Department of Human Services, so we are not the only division. We are one of several divisions. And yes, we are focused on supporting people who are blind, deafblind, and visually impaired, but the Department of Human Services, they support persons with disabilities, as well as persons who may not have any disabilities. Department of Human Services, they cover areas of childcare, areas of Medicaid, health insurance programs, and I think also what Joe was saying, emergency management. So we have several resources and we work very, very closely together. So one of the things that CBVI has been doing during the pandemic is to refer people or give them resources. Basically, we've had people call in terms of being able to, or not being able to get food, having issues with food delivery systems, and we've been able to help with that. We've also had people have concerns about transportation, and at present that's not something that we're able to do, but sometimes talking with people, allowing them to think about the resources that they have either with their families or in their communities that they can use to face the different challenges. Social distancing, of course, has been huge. Most of all of our services are offered on an itinerant basis, which means we go into people's homes, we meet people where they're at. And because of social distancing, we've had to create a remote platform now. And I'm happy to say, I'm very proud of the team that I work with at CBVI. We're still doing a lot of good work. The state is working very hard still to deliver quality services to people throughout the health crisis. So our education services, our teachers have been working remotely. We have been utilizing assistive technology with our students. They are able to communicate with their teachers via teleconference or video conferencing so that they're still able to learn and to compete with their sighted peers. We also are continuing to teach Braille. We're all about Braille literacy at the Commission for the Blind. So we're very happy that we're able to continue with that. We have specialists that teach assistive technology, whether it be for students in regards to their education or people who are working, who want to work. In terms of we have a small, we have a federal and state, a federal program that covers blind entrepreneurs. We also have supports for small business owners. As you can imagine, as the larger society has had a huge, just distraught astonishing impact of not having income, having businesses go under. So we've actually had phone calls with many of our small business owners to see what resources that we can offer, the guidance through the unemployment insurance applications, and also the process, just getting an understanding of what it is, and also just letting people talk sometimes, because the wait, sometimes it's hard for other people than others. So we've been calling all of the consumers that we work with, whether they're in our education service program, our vocational program, independent living programs, and people are in such need just for the connection to say, hey, we're checking in, how are you doing? What do you need? And we're very happy to have the Department of Human Services, because we all work very closely together. So if there's something that CBVI doesn't cover in terms of housing or finances, we can always lean on the department and to help us. So I also just wanted to say people have had a huge problem with getting prescriptions besides food. That's been a biggie. So we do have some resources that if somebody's having an issue with getting prescriptions, we can help link them to those resources. We also offer services, as I said, to deafblind persons. I really appreciated the comment by Arlene in regards to when you have the mask, literally you're cutting off communication with some people. Our team was recently able to develop a healthcare guide for health professionals. And so that went out on yesterday. We're hoping to distribute it even further, because it's really tough. Like you said, everything with this pandemic is unprecedented. People are fearful and scared. So we're very happy that we're able to bridge that gap in some way. Elizabeth, I think I might want to pause if somebody has questions.
Yeah.
A good time.
Thank you, Dr. Davis, for all of that really important and helpful information. We'll open it up for a Q&A. I just want to say if somebody has to jump off, we're at the hour, but for all of us who can stay on and just continue our conversation for a little bit longer, we're really grateful to everybody to be able to do that. So I have a question I want to ask Dr. Davis and also Scott, but I'm going to turn it over to Kacy first, just to see if we've got any other friends on the call today who have a question for Dr. Davis.
Sure. Again, if you have a question, you can drop it in the chat box or unmute yourself or raise your hand via the participants icon. I do see one question about the teaching of Braille. This individual is curious to know if that's only for people with low vision or blindness. Could anybody learn this? I'm not sure what the commission's restrictions are on teaching that, but clearly there's interest.
Thank you. So the Commission for the Blind, that we have eligibility requirements. So it wouldn't be just like anybody could come and learn Braille. It would be for persons who are deemed eligible, and certainly anyone could from that point.
Great, thank you. Elizabeth, as of right now, I'm not seeing other questions. So if you want to ask yours, we'll see if any others come up while you're doing that.
Thanks. So I'm curious, Dr. Davis and also Scott, if you have other ideas on this as well. But we've got some colleagues on the call today who do not traditionally serve communities of people who are living with disabilities. They're running other kinds of nonprofits, and sometimes we know there's disconnect sometimes, or we want to help close that gap. So I wonder, are there things like during this difficult time, are there ways where all of us can be more inclusive of all of the work that we're doing in order to make sure that we are involving, our neighbors who are living with disabilities? Like, do you have any suggestions or advice of how we can all do better in this area?
Go ahead, Dr. Davis. I have it's definitely
Well,
something to say to that, but go ahead, please.
Well, one of the things that the commission programs that we have is the Aspire program that I spoke of before, our peer-to-peer support program, and it's incredibly diverse. We have generally the people who are members of the Aspire, whether it's a nonprofit or individuals, they do have either blindness or the deafblind or visually impaired, but I certainly know that there's been speakers that have been at peer-to-peer support groups. The Commission for the Blind, we've also had speakers that come in so that, or teleconferences so that people are connecting. When we talk about resources, we have a community outreach coordinator. We also have social workers. So in terms of inclusion, because as we know, no one individual is just one thing. It's a holistic, approach that we take. So if we encounter someone or a consumer of ours, they come up with a different need, we certainly address that. As I said, we work with our sister divisions in DHS, so the Division of Developmental Disabilities. We work with, and so we're open to working with several groups, depending on what the need may be as they arise. Scott, I don't know what your experience is, as I know that you have a breadth of persons who have various disabilities, but from our perspective, that's how we incorporate other people.
Yeah, and I think the Center for Independent Living, the independent living world, as I know it, feel it, and see it for years, is we try to build relationships with any organization, nonprofit or for-profit. Many of us are involved in the local chambers of commerce, Rotaries. So there might be a service that's offered that could be helpful to an individual or a family. I don't think we draw a line. We don't want to do that. I mean, it is all about diversity. I come from 25 years in the corporate world. So employment, for instance, here we're looking for jobs and internships for younger folks or anybody with a disability. So, there's a relationship builder right there. Now, during the pandemic here, I've been involved in the Mercer County, or the Mercer, they call it the Mercer Community Organizations Active in Disaster. And that's any community. So that's, we of course, we've got some things like Trenton Area Soup Kitchen that has, it's serving folks, it's a nonprofit, but it's serving just about anyone in need. So again, I think that needs to be wide open to all of us. I really don't even look at that nonprofit, for-profit, or disability, not disability. And I'll say this, 20% of our population are people with disabilities. So guess what? All those organizations let's stick with nonprofits for a second, most likely have folks, and don't get me wrong, there's a lot of folks with hidden disabilities, mental health issues that you wouldn't really see right away, but that's a big world, a very diverse world out there.
Right. Thank you both, because I know that, some of our other nonprofit colleagues on the call today, I want to encourage all of us to figure out how we continue to make our organizations and our programming and our services as inclusive as possible to all New Jerseyans. So I just, want to encourage all of us to keep thinking in that way. I think there are a couple of questions in the chat function, Kacy. Do you want me to turn it back over to you, or?
Yes, we can certainly do that. It is 11:09, so just to do a time check for everybody. We have a couple of questions related to assistive technology consultants from the commission and their ability to participate in IEP meetings. Dr. Davis, I don't know if you can speak at all to how that's working. There's a couple of specific aspects that this individual is asking about, specifically in writing the goals of those IEPs and having assistive technology consultants that are sort of tech savvy enough to be able to assist with that.
So our assistive technology services, it is not a separate service program. It is actually a program that a student, let's say, would have to be assessed for. And our teachers of the visually impaired, they are our representatives at any IEP. We do have contracts with school districts, and the schools, they contract for Braille lessons, any service that the student may need to make sure that they are competitive with their sighted peers. And our teachers of the visually impaired, as I said, they're at all the IEPs if there is a consumer that they are servicing. And they work with all of our services together. So if there is an assistive technology specialist, the teachers work hand in hand with that assistive technology staff person, and they are the coordinator and the person who brings everything together. So if a student is receiving services from the Commission for the Blind and they have an IEP, that teacher is a conduit for any other services or assessments that are needed. But assistive technology, that is not a separate program at the Commission.
Great, thank you. There was one other question here, I think that probably goes more for Scott. Are there stress management programs in place that can help case managers and mobility specialists decompress and take care of themselves during this challenging time? This person's really grateful for the team that works with them and wanted to know a little bit about how they can take care of themselves.
Well, I do know, go ahead.
Go ahead.
This is in regards to orientation and mobility specialist. So the state of New Jersey, the Department of Human Services, has been great at putting out emails, letting people know that the Employee Assistance Program is available. And that particular program, that's counseling services, support services for our staff that anybody can actually access as long as you are an employee of the state of New Jersey in any capacity. And it's needed. It's needed. So definitely they've been just letting people know, putting out email blasts, because we certainly all need support at this time.
And just to echo Dr. Davis's input, it's very much needed, more needed now, as we're seeing. But there's many local resources and larger resources for counseling, for therapeutic counseling and other types of counseling. I know a lot of it overlaps into the mental health field. And again, one of our neighbors is, there's a large area with mental health, and that can impact people with physical mobility issues and other issues as well. So
absolutely.
If there's even after this, if there's other questions, feel free to contact me at the office, or I think, are you going to share my email, Elizabeth or Kacy?
If you would like us to, we absolutely can. We wanted to check with you first, but we can certainly do that.
Yes, and the office phone number, we do have a couple of folks in the office. Most of us are working from home. We're in operation, but in a different way today, obviously, like most of you know. But we're really consider ourselves in full operation other than face-to-face meetings right now. So I'd be happy to take any questions via phone, which is 609-581-4500. And I'll get those calls or my email address.
Great, thank you.
And also, Elizabeth, I just wanted to just to add that anyone can feel free to reach out to CBVI at 973-648-3333. And we also have an email address, askcbvi.nj.gov. So that's www.cbvi.nj.gov.
Back to that question also answers, because there's various ways to look at answering. The center's staff, a lot of times people just need to talk to somebody, We're not certified counselors, et cetera, but we're finding it, especially now.
Right.
But ongoing. Again, it's one of our we're open to variations of services and supports across the board on a regular basis, and it's just enhanced now.
Yeah. Thank you.
Great. I just want to ask us to pause for a quick moment so that if we continue for a few more minutes, we give Tabitha a break and switch over to Audrey as our ASL interpreter that'll take us out through the end of the day. Because Tabitha's been doing it for a little while now. Thank you, Tabitha. So for those of you who are utilizing ASL for these last few minutes, we're going to switch back to Audrey. So unpin Tabitha and go ahead and pin Audrey's video to your screen. Great. Thanks, ladies. Elizabeth?
Great. Thank you, Kacy. So Dr. Davis and Scott Elliott, thank you both so much for being with us today. You've shared just a tremendous amount of information with us. We also thank Joe Geleta, who had to drop off a few minutes ago. Big thanks to Debbie Duncan at the Center for Nonprofits and Crystal Allen at Eyes Like Mine. We applaud you both and all of the work that you're doing. You know, we thank everybody for sticking with us as we went over a little bit today. Just before we sort of stop our recording, I just want to make sure that you hear a hello from our team member, Jeanette Mitchell. Many of you know Jeanette. She's going to put some social media links into the chat function for us. But Jeanette, I'm going to just unmute you here. Do you want to just say a quick hello to everyone? I can't unmute you. I think you have to do it. Oh, there we go.
Got it. I just got it. Hi, everyone. How are you today? I know that we are running over time, but everybody seems very engaged. Thank you so much. I am the program associate for Creative New Jersey, and so I'm just going to connect you with our Facebook pages. We have 10 different group pages that you can connect with for different parts of New Jersey, and we're on all the 5 different platforms: the LinkedIn, the Twitter, Instagram, and YouTube. So I'm just going to paste those on the side, and you guys can connect with us ASAP.
Great.
Thank you. Thanks, Elizabeth.
Thanks, Jeanette. And then our other team member, Alyssa, has been taking lots of notes today. As Kacy said earlier, all the information that people have shared in the chat function will be incorporated into the notes. We've got some additional information from Scott and Dr. Davis and Joe Geleta and Crystal that we can incorporate into the notes. You'll all receive that at some point tomorrow or Friday. If you have any issues with that or you don't get it for some reason, please make sure that you reach out to us. We've got a couple of more Wednesday morning calls that are lined up. Next week, our call will focus on resilient senior living during the pandemic. And we're going to hear from Michael Oakes, who's with the Spring Point Senior Living Center Foundation. And we're going to hear from Janet Sharma, who is with Age Friendly Englewood. So we're going to, talk a little bit more about how the pandemic is specifically affecting seniors. But, as we heard today, we heard some talk about, how it's impacting some mature adults who are living with disabilities. And last week, or maybe it was the other week, a sense of time is difficult these days. We had a call on mental health, and we certainly talked about how older Americans are challenged with COVID-19, even if they're not connected in a sort of high risk group in a sense. So anyway, and then we're going to talk about food security on May 20th. So keep an eye out for those announcements.
I have
about the
dropped the registration link. Sorry, Elizabeth, to just jump in there. I've dropped the registration link for our future calls, both the Zoom registration link and the Google form that is screen reader friendly for those of you who are running into that issue with the captcha code on Zoom. So you can go ahead and register there. And then also I've dropped in the COVID-19 resource page on Creative New Jersey's website, which houses the recording of the videos that we've done and all of the resource summaries that we've created, which you can download from our website. Those are all on that page. But you can always find it just by going to creativenj.org as well.
Great. Thanks, Kacy. Thanks to all of you for being with us today. Thanks for your partnership and your collaboration. Thank you also for teaching us about how to continue to make our programming as inclusive and as accessible as possible. We are learning from you. If you have other ways that we can improve our work to continue to be more inclusive, please don't hesitate to reach out to us. Kacy and Jeanette and Alyssa and I are really committed to this. Arlene, I'm going to follow up with you regarding the comments you made earlier, but you know, we're a team here collectively. You know, all of you are connected to networks around the state that serve, you know, lots of people. And so we want to continue to strengthen our network with you so that by extension, we can continue to build a collaborative, inclusive, and equitable New Jersey. So thanks very much.
And thank you,
Thank you.
Lastly, to our ASL interpreters, Audrey Jobert and Tabitha Lee. We are so delighted that you could be here with us today, right? You shake your hands to say thank you and clap. So that's how we do it here for those who need to see it. And then thank you also. I know you're going to say this too, Elizabeth, but thank you also to our speakers. We're delighted that you're able to be with us for this time. So I'm going to go ahead and stop the recording for now. Again, for anyone who wants to stay on, they can. Our ASL interpreters were only contracted through this time, so if they need to go, they'll step off. But we are delighted to continue the conversation after this. So thank you.
Thanks, everyone.
Thank you. Thank you.